Hi guys, I'm back today after months and months of having been away, and I'm really excited about today's video because today I'll be talking about something that I think is really one of the next big things in genetics, and that is something called polygenic risk scores. So if you're new to my channel, hi, my name is Rachel. I'm a genetic counselor and I specialize in hereditary cancer. So I see patients to discuss their personal and family history of cancer, and then often we do genetic testing to see if they carry a rare mutation in a gene that might put them at higher risk to develop cancer. But for most people, that testing actually usually comes back negative without any genetic mutation telling them that they're at very high risk. If it does come back positive, we can use that information to be very proactive about a person's cancer risk. We can talk about ways that they can screen starting at a younger age or do things to reduce their risk of cancer. But what do we do for all those people who test negative, which is the majority of the patients that I see? About 90 to 95% of the patients that I see will usually come back without a high-risk genetic mutation. So what do we tell them about their cancer risk? Well, that's where polygenic risk scores come in. So in today's video, I'm going to explain exactly what polygenic risk scores are, how they can be used to determine somebody's risk of cancer, and also some of the concerns about this kind of testing. So today's video is actually a collaboration with two other genetic counselors, Dina DNA and Katie Lee CGC. Today on their channel, they have both released videos also related to polygenic risk scores. If you're completely new to polygenic risk scores and you've never heard this term, I recommend that you go check out Dina's video because that will give you a good foundation, kind of like a polygenic risk scores 101, and then come back and watch this video where I'll explain how we use polygenic risk scores in a cancer setting. And then Katie, who's a genetic counselor that specializes in reproductive genetics, is talking today about how we use polygenic risk scores in that kind of setting. So I'll link both of their videos down in the description box so you can go check them out. And just in general, their channels are full of really interesting videos, so I really recommend that you check them out. Okay, so let's get started. What are polygenic risk scores? Well, if you haven't had a chance to check out Dina's video, I'm going to give a brief overview of what polygenic risk scores are here on this video. So in order to understand what polygenic risk scores are, we actually have to take a step back and learn about something called SNPs, or single nucleotide polymorphisms. So your entire genetic code is called the genome, and the genetic code is made up of 4 letters, A, T, G, and C. These are also known as nucleotides, and we have about 3 billion of these nucleotides within our genome. As you might have heard, humans share about 99.9% of their genetic material. That means that the differences that you see between people is really only attributed to that 0.1%. So let's say we look at a particular location within the genome, and we see that 95% of people have a T at that location, and 5% have an A at that location. Those would be called variants. You can have a T or an A. And that specific location, since there could be these different variants, would be called a single nucleotide polymorphism, or a SNP. And we each have about 10 million SNPs throughout our genome. So for the most part, SNPs are neither good nor bad. They're just simply the variations that make us different from one another. Like for example, if you're doing ancestry testing, the specific combinations of SNPs that you carry can be used to predict your individual ancestry. But there are some SNPs that have been associated with disease risk. So the way these disease-related SNPs are identified are through huge studies known as genome-wide association studies, or GWAS. And the way scientists do these studies are by comparing 2 groups of people, one that has a disease in question, let's say breast cancer, compared to a group of people that doesn't have the disease. And they will look at the SNPs in both of these groups and compare them and see which SNPs are most different between the 2 groups. And they will see that some SNPs really stand out as being very different between the 2 groups. So that will identify that SNP as being related to breast cancer risk. They can also tell for each individual SNP how highly related it is to breast cancer risk. So some SNPs might be associated with a higher risk than others. But usually the magnitude of risk for each individual SNP is extremely minimal, meaning just having one of these SNPs is not going to change your overall risk of breast cancer significantly at all. But when you combine a whole bunch of SNPs, let's say about 100, then you can start to see an overall positive or negative effect on a person's risk of disease that is significant. In other words, the combination of SNPs that you carry might make you have an overall higher or lower risk of breast cancer compared to the general population risk. So how do we go from SNPs to polygenic risk scores? Well, we take a whole bunch of SNPs together, let's say again 100 SNPs, and that is combined together with other risk factors such as lifestyle risk factors or family history, and that gives you your polygenic risk score, or PRS for short. So the polygenic risk score is expressed as a percentage, and that gives you an estimate of your disease risk. So how can polygenic risk scores be used to improve cancer risk prediction? So I'll use breast cancer as an example, but this can also be used for other types of cancers. So the way we calculate a woman's risk of breast cancer is by taking into account different risk factors. One which is really important is whether she carries a mutation in a high-risk gene, such as BRCA1 or BRCA2 or one of the other breast cancer-related genes. The other important thing is family history, as well as lifestyle and hormonal risk factors. So when we put that all together, we can estimate a woman's risk of breast cancer. But now we also have polygenic risk scores, which are one more tool that we can use in giving the most accurate risk of breast cancer possible. And if we can improve our risk prediction, then we can have more personalized screening and prevention strategies. So when we think about breast cancer risk, we can think about 3 different categories of risk: low risk, moderate risk, and high risk. Having a lifetime risk of breast cancer under 20% is typically considered low risk or average risk. And women who fall into this category should be screened just like the general population, which in the US means starting mammograms on an annual basis at age 40. The next category, moderate risk, is when a person has a risk of breast cancer between 20 and 50%. Breast cancer screening usually starts at a younger age, and in addition to an annual mammogram, we usually recommend an annual breast MRI. When a woman's lifetime risk of breast cancer is greater than 50%, that's considered high risk, and this is usually where we start to consider the option of a risk-reducing mastectomy or a preventative mastectomy. So because there are differences in the screening and preventative recommendations across the different categories of risk, it's really important to try to get it right, to try to know exactly what somebody's risk is, because we don't want to be making inappropriate recommendations. So by adding in the polygenic risk score, that's just one more tool that helps us to more accurately define somebody's cancer risk. Now, if somebody has genetic testing and they're found to have a genetic mutation in one of the high-risk breast cancer genes, such as BRCA1 or BRCA2, they usually will fall into the high-risk category, and we have very specific guidelines that they can follow to be proactive about their cancer risk. Now, compared to BRCA1 and BRCA2, there are other genes which are associated with a more moderate risk of breast cancer. These are known as PALB2, CHEK2, and ATM. Typically what's recommended is to be screened with an annual mammogram plus a breast MRI. PALB2 is a little bit higher risk, so mastectomy can be considered, but really these are lower risk genes than BRCA1 and 2, generally speaking. But when we factor in other information such as the family history, lifestyle, and hormonal risk factors, and the polygenic risk score, we can further characterize their risk. And some people who have a mutation in this gene move out of the moderate risk category into the high risk category, whereas other people move from the moderate risk category into the low risk category. In the description box, I'm going to link to 2 really great studies that look exactly at that. They look at women who have a PALB2, CHEK2, or ATM mutation, and they see how adding in all these other risk factors, and especially adding in the polygenic risk score, how it can really have an effect on stratifying women's risk of breast cancer. It's especially important to be able to differentiate between the mutation carriers that are in the moderate risk category compared to the low risk category. Because currently we're recommending breast MRI for all these women, and that introduces increased expense, anxiety, the potential for false positive results. So if we can use the polygenic risk score to move some of these women into the low risk category and avoid all this unnecessary overscreening, that would be ideal. What do we do for all those people who test negative? Sometimes adding in that polygenic risk score will be enough to move them from the low risk category into the moderate risk category. So it's very useful for anyone who tests negative. Okay, so how can you get a polygenic risk score? Well, there are ongoing studies using polygenic risk score to help determine what's the most appropriate screening for different individuals, and as well, how can we use this for the general population and predicting people's cancer risk. But this is also something that is commercially available. There's a lab called Myriad Genetics, which is a clinical lab that offers genetic testing for a panel of hereditary cancer genes, But recently, in the last couple of years, they've also been offering a polygenic risk score. And this polygenic risk score can be calculated for the women that test negative through their broad panel of genes, but they also offer it for people who test positive for a CHEK2 mutation. There is a different company called GeneType, previously called Brevigen, which offers a polygenic risk score for breast cancer and another one for colon cancer. And they offer it as a standalone test. So as opposed to Myriad, where you get their hereditary cancer panel plus the polygenic risk score, GeneType looks only at a polygenic risk score. And that is a self-pay test. I think it's about $250 for each of the polygenic risk scores. And as far as I know, as of the filming of this video, Myriad and GeneType are the only labs that offer polygenic risk scores related to cancer, but I might be mistaken. So if you know of any lab that offers polygenic risk scores for cancer, please leave it in the comments. If someone had a polygenic risk score done, that information can be input into a program called CanRisk, which was developed in the UK, which is a calculator that estimates a woman's lifetime risk of breast and ovarian cancer. So they take into account different risk factors, including family history of cancer, lifestyle and reproductive risk factors, whether somebody carries a mutation in one of several genes, mammographic density, and polygenic risk scores. So this is one of the most comprehensive tools available, where you can plug in a whole bunch of data to estimate risk of breast and ovarian cancer. So right now, as far as I'm aware, it's only approved for use by healthcare professionals in the UK and Europe, but I'm just mentioning this as an example of a tool that takes into account a lot of risk factors plus the polygenic risk score. And as polygenic risk scores will become more common, I'm sure other tools will be developed that take into account that type of information to help predict people's risk of cancer. So, should you get a polygenic risk score? Well, one of the biggest concerns has been that since GWAS studies have been mostly performed in European populations, the data that's gathered from those studies might not necessarily be able to be extrapolated to other populations. But Myriad Genetics has recently announced that they have reconfigured their polygenic risk score to be able to use it in other populations, and they have validated this. So as of August 2nd, 2021, Myriad Genetics now offers their polygenic risk score to women of all ethnic backgrounds. So basically what they're doing is they're looking at a combination of ancestry-related SNPs and breast cancer-related SNPs. And based on an individual's ancestry, they will weigh each of the breast cancer SNPs differently. So now this tool can be used for women of all ethnicities, which is great. And GeneType on their website also claim that their polygenic risk score for breast cancer can be used for women of African American, Hispanic, and Caucasian descent. But their colon cancer polygenic risk score is still only for Caucasians. Hopefully moving forward, this will be less and less of a problem as polygenic risk scores are reconfigured so that they can be used as a pan-ethnic resource. The other major concern with polygenic risk scores is that we don't yet have guidelines on how we should be using these in practice. Currently, the National Comprehensive Cancer Network recommends against using polygenic risk scores in routine patient management, but rather they should be considered in the context of a clinical trial. I suspect that in the near future, guidelines will be developed on how we should be using the polygenic risk scores. But it's important to keep in mind that right now, since we don't have clinical guidelines, insurance is not necessarily going to pay for these types of tests. At Myriad, it's offered automatically. If you're already having hereditary cancer testing through them, they will include the polygenic risk score. But for example, at GeneType, that is a self-pay test, and if other labs offer it, it might be something that people have to pay for out of pocket. Another concern is that even if we had clinical guidelines, there's not necessarily uniformity across labs. They're not necessarily using the same exact combination of SNPs and taking into account exactly the same risk factors like lifestyle and hormonal risk factors. They're not necessarily taking into account everything exactly the same. So if you are getting a polygenic risk score through multiple labs, the numbers might not come out exactly the same. Usually I expect that they would probably result in people falling into the same type of category. Like if you're low risk, chances are that if you had a polygenic risk score at a different lab, it would also come out as low risk. What if we test them through a lab and using the polygenic risk score, their lifetime risk of breast cancer is estimated to be 18% or 19%. they're right at the threshold of that low and moderate risk categories. What if we had tested them through a different lab and their risk actually came out to be 23%? And that makes a difference in terms of what kind of breast cancer screening we're recommending. So that, I think, might be another concern. So I guess we'll need to figure out how to have some sort of standardization across the different labs. So in summary, I think there are still some concerns about using these polygenic risk scores in clinical management, but as time goes on, I do think these will become increasingly used to help stratify people's risk and make sure we're screening people in the most appropriate way. Whether they test positive for a mutation or test negative, we want to be able to give people the most accurate cancer risk. So like I said at the beginning, I do think this is probably one of the next big things in genetics. Oh, and by the way, I'm planning a future video that will focus on SNP-based testing through direct-to-consumer companies and third-party interpretation websites. So stay tuned for that one. Thank you so much for watching today's video. I hoped you enjoyed it. I hope you learned something new. If you did, please give it a thumbs up. That really helps my channel. And if you have any questions about anything I talked about, please leave it in the comments. And I'll see you in my next video. And please check out Dina and Katie's videos. I think you'll really enjoy them. Thank you. See you next time. Bye.